Hello and welcome to Mullen's Benefits Companion, a podcast that helps employers navigate the complex legal challenges of managing their employee benefit plans. I'm your host, Brydon DeWitt, and today I'll be discussing a very hot COVID-related topic that's been in the news lately. Can employers impose a health insurance surcharge on plan participants who are not vaccinated for COVID-19? Delta Airlines recently made national news with its announcement of a $200 health insurance premium surcharge to be imposed on employees who have not received the COVID-19 vaccine. And now many employers are considering following Delta's example in order to encourage employees to get vaccinated. And while this health insurance surcharge is permitted, employers need to be very careful with how they implement it, especially when you're dealing with an incentive regarding a group health plan. Group health plans, of course, are subject to the HIPAA nondiscrimination rules as well as the Affordable Care Act. Under HIPAA, an employer or a plan may not charge employees more for coverage or give a reward to employees based on an employee's health factor. And so being vaccinated or receiving a vaccine is arguably a health factor under the HIPAA nondiscrimination rules. And under HIPAA, when you are dealing with a health contingent reward, the reward can only be provided or the surcharge can only be imposed if the program complies with the HIPAA non-discrimination regulations exception for a bona fide wellness program. And under those regulations for health contingent programs, a wellness program can either be considered outcome-based or activity-based. And given a lack of guidance, it's not entirely clear whether a health insurance surcharge based on vaccination status should be treated as an outcome-based program or an activity-based program. The most conservative approach would be to treat the surcharge as an outcome-based wellness program under the HIPAA non-discrimination rules. And what that means is, under HIPAA, if you have a health contingent wellness program, a reward based on a health factor, or a surcharge imposed on participants based on a health factor, the program must provide participants who do not meet the standard an alternative means of earning the reward or avoiding the surcharge. And so if being vaccinated is treated as a health factor, is treated as an outcome, similar to achieving a certain BMI or achieving a certain blood pressure or cholesterol level, then it would be an outcome-based health contingent wellness program under the HIPAA regulations. And any non-vaccinated participant would have to be given an alternative means of avoiding the surcharge. So that could, if you treat it in the most conservative manner, if you treat a health insurance surcharge based on vaccination status as an outcome-based HIPAA wellness program, the requirement to offer an alternative means of compliance really kind of guts the program. I mean, what would the alternative means of compliance be? It could be masking, it could be following social distance requirements, it could be remote work. But it makes the surcharge a lot more difficult to implement if you treat the program as an outcome-based HIPAA wellness program. Of course, that's the most conservative interpretation. Another reasonable interpretation is to treat the surcharge as an activity-based wellness program under the HIPAA regulations. And if the program is treated as an activity-based wellness program, an alternative means of compliance still has to be offered, but it would only have to be offered to participants who are unable to get the vaccine due to a health factor. So if their doctor says it's not advisable or they are not able to get the vaccine because of an underlying health condition, those are the only participants to whom you'd have to offer the alternative means of avoiding the surcharge. And again, those alternative means of compliance could be a masking requirement or social distance or working from home. And then whether you treat the program as an outcome-based wellness program or an activity-based program, the program would still have to comply with the other requirements that apply to HIPAA wellness programs. And so those include an annual opportunity to earn the reward or avoid the surcharge. There is a 30% cap on the amount of the surcharge. So the surcharge cannot be greater than 30% of the cost of employee-only coverage. And then this alternative means of compliance must be disclosed to participants in every communication that describes the surcharge. So it's important for employers that are thinking about implementing the surcharge that this program has to comply with the HIPAA non-discrimination rules, and then make a judgment as to whether the employer is going to treat it under the most conservative interpretation of the HIPAA regulations as an outcome-based program, or treat the program as an activity-based program under the HIPAA regulations. So that's a decision that the employers are going to have to make. And then I also want to mention the Affordable Care Act. Under the Affordable Care Act, an employer that offers health coverage to employees may still be subject to the employer shared responsibility payment if the coverage offered to employees is not affordable. So if you offer unaffordable health coverage and an employee goes to the healthcare exchange and qualifies for the premium tax credit, the employer will owe an ESRP, employer shared responsibility payment, for each month that occurs. And that's for this year, for 2021, that would be $338 per month per employee who qualifies for the premium tax credit through the through the Affordable Care Act exchange, if the coverage offered by the employer is not affordable. And under the ACA regulations, a non-tobacco based wellness incentive is added to the cost of coverage when determining whether the coverage is affordable. So an employer has to, if you're going to impose a surcharge, an analysis has to be performed to confirm whether the amount of your surcharge, when added to the cost of coverage, the employee's cost of coverage under the employer's plan, would cause the coverage to be unaffordable for purposes of the Affordable Care Act. And if it becomes unaffordable, the employer runs a risk of owing the employer shared responsibility payment under the Affordable Care Act. So that's an important consideration and an important analysis that has to be done to make sure the surcharge doesn't expose the employer to additional penalties under the ACA. So those are just a couple of items. There are also issues with the EEOC and GINA and the Americans with Disabilities Act, but I really wanted to point out in this podcast the importance of complying with the HIPAA non-discrimination rules and the risk of the surcharge causing the employer's coverage to become unaffordable for purposes of the Affordable Care Act. So that'll wrap up our discussion about health plan surcharges. Please note that if you're listening to this podcast before September 15th, there is still time to register for our annual benefits forum that's slated for Wednesday, September 15th at 11 o'clock a.m. Eastern Time. It's free, and SHRM credit has been applied for. Visit williamsmullen.com to register. Finally, be sure to subscribe to this podcast to be notified when our next episode posts. Thanks for listening.